Hello everyone, thank you for joining us for the WCMS annual business meeting. We appreciate you attending this virtual experience. We know it's not the ideal situation, but as we continue to receive our vaccine and immunize our community, we will soon be able to meet again in person. I've really been very proud and honored to be president of the Washoe County Medical Society, and I'm even more honored and proud to present this plaque to Patrick Woodard, our new president of Washoe County Medical Society. Patrick, congratulations. Look forward to working with you.
Thank you, Jay. I'm sure we will be working, even though you might tell me you're trying to go to Hawaii. And although I really appreciate the plaque, I'm sad there's not a gavel, although I'm not sure how useful it is on Zoom. We'll figure it out. But I really think this is a good size plaque. But this is a better size plaque. Jay, this year has been a struggle and a challenge for everyone for many reasons, but we couldn't have done it without your level-headed leadership. It really comes from the bottom of our hearts, myself and on behalf of the entire Washoe County Medical Society, to be able to say thank you. Thank you for your leadership over the last year. You've been level-headed, and I really want to thank you. Your leadership has just been phenomenal.
Thank you, Patrick. And it's really been an honor to be president of the Washoe County Medical Society, and I look forward to working with you in 2021 as you are president of the Washoe County Medical Society. This has been a difficult year for many reasons. We were especially touched by the loss of colleagues and friends. We were saddened by the deaths of Washoe County Medical Society members Shazi Matthew, Michael Morgan, Stephanie Reinhardt, Lex Simpson, Paul Shakespeare, and WCMS members Ruth Ann Kelly, Jean Mullins, Eva Rosenauer, and Mary Yamamoto. I have been honored to serve as president of the Washoe County Medical Society. While this has been a challenging year, we have made it better together via numerous Zoom meetings and collaborations in defeating the challenges of COVID. I'm extremely proud to be part of this medical community. We all need moral support and good mentorship, and I have received that in this community for many years. This year has taught me many lessons, especially concerning the need for organized medicine. The COVID pandemic has been extremely difficult to deal with. I congratulate all my colleagues who are treating their patients in the face of COVID, especially those in the intensive care units, in the emergency rooms, and in the operating rooms where they're exposed to COVID, oftentimes without knowing. Staying the course is taking extraordinary stamina, dedication, while striving to maintain some level of family connection and care for our loved ones. The strength of the Washoe County Medical Society and its members is sustaining, and it has sustained us through this crisis. One of the bright spots is the increased participation of the younger generation of physicians who are bringing new energy and ideas to this association. I'm excited and proud to be working with these young physicians, such as Patrick Woodard and many others who are joining us. They are the future of organized medicine in our profession. Presenting a unified front to our community increases our ability to have a necessary voice in healthcare and in their care. And with the upcoming legislative session, it is imperative that we are heard in order to keep our doctors in Nevada and make this a better place to practice. I want to thank the 2020 board and committee chairs who have provided leadership and support throughout this year. We've adapted in many ways that have been necessary to keep Washoe County Medical Society strong and growing. Many of the board members are continuing, including Patrick Woodard, who will be president, Shana Richardson, president-elect, Bayo Curry-Winchell, secretary-treasurer, and Robin White, delegate chair. Directors will be Thomas Christensen, John Hardwick, Ali Nurizi, Tim O'Mara, Daniel Spogan, and Natasha McGlon. Retiring from our board are Reed Doff and Jake Blake, who has spent countless number of hours helping us for the last year, and Reed has been there for many years. I want to thank Reed Doff and all the other former presidents who have given me support during my tenure and helped me make it through. Special thanks to Ron Smith, who has kept our PACs going and has also kept us involved in the governmental affairs side of things, and Kevin Murphy, who has given many talks concerning COVID and has spent many hours in preparation for this. I want to also thank our board member and committees and members who have volunteered their time. Sincere appreciation to Marianne McCauley and Wendy Hernandez, for without them, we could not have made it through this year. And of course, I thank Sherry Morgan, who so often is my lifeline when I get lost at sea, and Lord knows I'm lost at sea many times. I want to now introduce and invite Patrick Woodard to join me.
Hello, everyone. It is my pleasure and my distinct honor to become president of this organization. I have been involved with organized medicine in some capacity since my very first year of medical school. And in those early years, when I was the only one, I was the de facto head of recruiting. I was also treasurer, but because we had no money, that was pretty easy. Plus, as a student, it was pretty easy to convince other students to join. There was free food, and everyone mostly had the same interests: graduate, get into residency, and show that you were at least a little bit engaged along the way. As we all spent years in our respective specialties, it became easier to focus on specialty-specific issues, and things like playful rivalries: surgery and medicine, hospitalist and consultant, physician and APP. But what I always thought was the beauty of organized medicine, like the Washoe County Medical Society, is that it has always recognized that our shared interests and our shared goals outweigh the minute differences between us. Nothing has demonstrated that more than the challenges of this past year. Though we began the year like any other, COVID quickly tested us in ways unlike any of us have faced. It impacted us personally, and it impacted us professionally. For some of us, it was far fewer patients and canceled procedures. For others, it was many more patients, difficult conversations, and tough decisions. Across the spectrum, this pandemic has demonstrated the fundamental need for a trusting relationship between physicians and patients. This trust must extend beyond a hospital bedside or the exam room. This trust must persist across time and across disease states. And this trust is necessary whether it's in person, via video, or through the media, as public servants like Dr. Fauci have demonstrated. The future of medicine, based on this trust, will rely even more on the physician-patient relationship. Over the years, we've become increasingly disconnected by coding requirements, increasing documentation complexity, EMRs, computer screens. We become disconnected through burnout, through politics, through social and societal crises. But I know the fundamental element remains. Our position as physician is established through our relationships. That means we must act to remove the elements that reduce the quality of these bonds. We can do this by advocating to reduce paperwork, simplify coding, reduce EMR complexity, supporting our colleagues, and by improving social determinants of health. And lastly, we must act to improve public health, including things like vaccinations. That's why we are all here. We each have our areas of passion and skill, but when we work together, we do more for the greater good. It's the work of advocacy, something we are uniquely positioned to do. We all already act as advocates for our patients and provide counsel to those around us. As an example, just last week while I was on service, I was talking with a social worker who regularly interacts with patients, including those in the ICU and the ER who have active COVID infections. She told me she was afraid to get the vaccine because when she was a kid, she had severe allergies. I listened to her concerns, I shared my own experience getting my vaccine, and I shared why I knew it was safe. I asked her to consider getting the vaccine. At the time, she demurred, saying she would think about it, but 2 days later, she came up to me, proudly rolled up her shirt sleeve, and showed me her Band-Aid. It's not because I had a magic wand, but that I was willing to listen and share my knowledge. Similarly, our medical society is well positioned to listen and be those experts. In this way, the Washoe County Medical Society advocates for our broader community. The work we do, multiplied across our membership, will have us working together to truly transform our community. I am excited for this year, and not just because the bad 2020 jokes will stop. For the first time in most of our careers, we will see the direct impact of our work, not just on a patient, but directly on our whole society. As an internist, I am used to interventions having no visible benefit for patients over the course of months, years, or even decades. Some of my surgical colleagues might tell me that my interventions have no benefit at all. And I'll admit I'm jealous of them who get to fix things in real time. But this is the year in which medicine will directly improve society while we watch. Talk about a membership perk. We have always understood our profession to be one of patient advocacy. It is encoded in the beneficence of our oath. And whether we realized it or whether we wanted it, we are community leaders. In our case, it is as part of the Washoe County Medical Society, where we advocate on behalf of our broader community. This includes in those matters that impact health, but are not strictly sick care or well care. Things like vaccines, food deserts, tort laws, and health insurance coverage. Because we take this human-centered approach to our advocacy, we set the groundwork to create and maintain trust. After all, it's the foundation of our relationship with our community. Now, in a normal year, I would list specific goals or achievements we should accomplish, or projects we should undertake in the next 12 months. But because of ongoing uncertainty, I really only have one goal: be an advocate. It is our foundation. We know how to listen. We know where to go. And so to my colleagues who join me on the board, Sharon Wright, Lars Webb, and Daniel Hansen, we are grateful you will share your wisdom. To Shayna and Bio, who will take on this position in the coming years, thank you for letting me learn from you. And to my colleagues in the Medical Society, I look forward to a very meaningful year with you. Thank you for being part of it.
Good evening, I'm Kevin Murphy. The Washoe County Medical Society offers an opportunity to work with colleagues who share your values of commitment to patient care and the ambition to see the structure of that care improved and protected. We are not just physicians of different specialties, but of different philosophies, of different religions, of different politics. But we share those same values. The common ground we stand on is the compassionate care and scientific excellence of the care of our patients. The very fact of our differences makes us all the stronger together in advancing the quality of medicine. Thank you.
Being part of the Washoe County Medical Society has brought me in contact with multiple physicians in the community, from which I have developed some strong professional relationships as well as some personal friends. And as a young member, it's been very nice to be more involved in the community and actually have a say in certain healthcare policies and messaging to our community about medicine. And for that, I'm very thankful.
The medical community in Washoe County seems unique to me. It's big enough to provide health care to the community in almost all areas, but small enough that we are all interconnected. The community of doctors and other providers really embraces the responsibility to improve the health of the population, and I am proud to represent this group. Thank you.
The Washoe County Medical Society is important to me because this is my community. This is where I'm raising my family, where I care for my patients, and I want to be involved in the decisions that are made here and have an impact on the things that are important to me and our community.
I value my membership in Washoe County Medical Society because as a medical student, I want to learn about the issues that are facing the medical career and our patients. I enjoy advocacy and health policy, and participation in Washoe County Medical Society is a great way to get involved with those things at the local level.
Again, thank you very much for coming to our virtual meeting for the Washoe County Medical Society 2020. I think we should probably have an in-person meeting. What do you think, Patrick?
I'm thinking I'll see you at Ranchera on June 12th. We'll give out some awards. We'll eat some good food. We'll drink some good drinks. We'll be in person. Will we see everybody else there?
I think so. I think people are really going to want to come after this.
I think so too.
And thank you very much for all you all have done this year, and we really appreciate you attending this meeting. Thank you.